Hi, everyone. Charlie Piermarini, physician associate here with Stephanie.
Hi,
Um, we
everyone.
are we are here today on episode 4 of MedCanna Today. And like our goal this whole time has always been to bring good, the bad, the ugly, the in between about medical cannabis. Everything from the medical science to the policy to the research to the community. And today's no different. Stephanie brought this article to our attention, and it's a really, really good article from actually JAMA Network, and it's very recent. It was published January 25th of this year, so super recent data. So, Steph, why don't you kind of give them a little bit of an overview of what's going on?
Yeah, of course. It caught my attention for a lot of reasons I will discuss in a little bit. The title of the journal is State Cannabis Legalization and Psychosis Related Healthcare Utilization. So basically, their hypothesis, their question was, is state cannabis legalization or commercializ I can't say that word. Sorry. Let's say legalization associated with increased rates of psychosis related healthcare claims. So basically they wanted to see if these states that have medical and recreational policies, if they've seen a rise in a diagnosis of psychosis. And they actually found no significant difference in the rates of psychosis. So
Right.
they had 63 million
Yep.
participants in a span of 14 years.
Yep.
Most participants were white women over the age of 65. But yeah, I was really happy to see that it showed no significant
Right.
difference.
And because even they state in the abstract, and I'll link the paper in the notes, but even in their abstract, they in the beginning part, the abstract is the basically the overall view of the paper. Um, they basically say we basically think there's going to be an association, and that's the conclusion is cannabis causes psychosis. Well, um, the cool thing that this data is they used something from the Affordable Care Act, the Obamacare.
Mhm.
Through that, they were able to capture. It's called the Optum Clinical Informatics Data Mart database. And it's identified commercial and Medicare Advantage claims database composed of more than 63 million unique individuals, followed from January 1st, 2003 to December 31st, 2017. Um, so it is a very powerful study in the sense of it's not just 1,000 people, 500 people, 63 million people. And the cool thing about this data is they're able to stratify it: age, sex, race, income, diagnoses. So it's very, very powerful. And that was one of the cool things that came out of Obamacare was the collection of this kind of data. So they're able to do what this is a retrospective. So they're looking um, backwards to see, looking through the data to see what was happening. And it's actually a very cool study. The study design is super easy. They didn't use any subjects. They basically just looked at the data. And so, Steph, one of the things that really caught my eye was in their introduction, the sentence is, um, simultaneously, the average THC content of herbal cannabis in the US increased from 4% in 1996 to 17% in 2017. Um, Basically showing that, and what me and you have talked about, and I talk about with my patients and clients all the time, is the cannabis today is not the same cannabis even 10 years ago. And so I think they were trying to tie these high levels of THC to an increased psychosis, and they didn't see, it wasn't clinically significant. So, what do you think about that?
I mean, I think it's great that they actually studied that, right? Because I do hear a
Right,
lot of patients tell me, this is not the same pot I used to smoke back in the days,
right,
back in the 70s. And I mean, I have to agree. I've done different dispensary tours and I've seen these percentages, like I've seen up to like 38%. And
oh my
I'm
God,
like, what is that? And, I mean, for patients who don't really know how to dose, or don't
right,
understand microdosing, they'll probably consume all of it, and
right.
so I
And
do. Go ahead.
that's what I talk about with my patients. I'm sure you do the same. Is telling them you don't have to feel high to have the benefits of cannabis,
No.
right? And there's a part of the society that wants to use cannabis to feel high, right? To alter their mental state.
Yeah.
But the majority of people that use it for pain management stuff don't want to feel high. They want to feel better.
Yeah, and
Um,
if they're
and
using it
yeah,
recreationally, I mean, that's fine. Like,
right,
kudos to them. It is what it is.
right.
It makes them feel better, and that's why they use it. But, our goal here with MedCanna today is responsible use for
Yep,
patients that are using it for an actual condition and need
yep,
monitoring and need dosaging. I mean, sometimes
yep,
you have to play around with the dosaging. So that's
right.
what we're focusing on. So yeah, I'm really glad that they brought
I'm really
that
glad you
up.
found this paper. Yeah, I'm really glad you found this paper because I thought for sure that they were going to be like, nope, this is bad. I mean, because there have been a rise in incidents of hyperinduced emesis syndrome with cannabis, right? Cannabis-induced hyperemesis. So
Yeah.
basically, if you smoke a lot of marijuana, you start to just throw up uncontrollably. The only thing that calms you down is sitting in a warm bath because it starts to take the blood away from your stomach and your intestines and puts it into the skin. And so that went up dramatically in a lot of these states when they started, legalizing it.
Have you
But
have
it's
you
good to see this
actually
like
seen that? Because I
I
haven't.
haven't seen it. You have not. I haven't seen. I've had a few friends text me about it from the ER, but I don't work in the ER, so I don't see any of that. Even in the urgent care, I never really saw it. I've heard about it from a colleague, but I've never seen it firsthand. No.
Because I did have a couple patients, pregnant patients that came in with lots of vomiting, nausea, but it was that are cannabis users, but it's too hard to determine whether it's
Right.
from the chronic cannabis use or from the
Right.
pregnancy. So I couldn't really
Right.
make that diagnosis.
Yeah, it's pretty tough. Right. You're nauseous during pregnancy anyway.
Exactly.
Yeah, but I think this paper, uh, you know, I like to frame this in the sense of just because this paper doesn't see an association doesn't mean that cannabis is meant for everybody, right? It's the right dose for the right patient at the right time, is what I always say. And they did observe a statistical significant association with cannabis and psychosis in this is a secondary analysis, kind of not their primary, but they saw an increase in the rate of psychosis related diagnoses among men, people aged 55 to 64, and Asian beneficiaries in states with recreational policies compared to no policy.
Yeah, I did notice
Um,
that.
so it wasn't their primary end goal, but it was their secondary. And I think that's just interesting. I think that age group is probably people that had used it maybe once before when they were younger in high school, and now they kind of came back to it. And I have seen some research about high levels of THC kicking off an underlying schizophrenic
Right.
issue, but I think the patients have already had it there, and this kind of just lit the flame. It was already kind of smoldering, and this kind of just pushed them over. But I wouldn't, man, I don't recommend anyone going into the dispensary by yourself, uneducated, and asking these people on what you should get because you're not gonna be happy.
Especially if you
They're never gonna
have
start
a history of schizophrenia. There's some bipolar
schizo.
patients
Yeah,
that are, have more maniac episodes that should also be very
right,
careful with certain
right,
cannabinoids and certain strains and the dosaging.
right,
Also, if you have like AFib or certain heart conditions, you should also be careful. So, like you
right.
said a couple of minutes ago, it's not for everyone, and you should use it
hmm
responsibly.
Yeah, and that's high doses of CBD, high doses of cannabis can interfere with anticoagulant medications. A lot of people that have had strokes, deep vein thrombosis, clots, pulmonary embolisms are on these medications, and so it can alter the bacteria in your gut. That's what's used to break down the warfarin or Plavix goes to the liver, and so it can alter those medications. And so it's always nice to check with your cardiologist, whoever you're talking with about. Can I take cannabis? Can I take CBD? Can you help me monitor my levels, make sure I'm doing okay? Um, and so, it was just impressive to see because this was funded. Let's see, we were just talking. This is fun. This was a there's no conflict of interest disclosed. So basically, what that means is the people that do the studies, the authors, didn't get money from some type of entity that has a vested interest in the results for this research. That's like saying I work for Pfizer. I pay Stephanie to study a drug that Pfizer created, right? That's a conflict of interest. I'm paying her a salary, and she's getting money from me to do research. That's a conflict of interest. They have no conflict of interest. And the funding and support, interestingly enough, came from the National Institute on Alcohol Abuse and Alcoholism, along with National Institutes on Drug Abuse. So this was a drug abuse, alcohol abuse funded research project. I'm assuming it didn't take a lot of money because it was a retrospective study. It wasn't, they weren't doing bench research. But, what else what do you think about this kind of research coming out? And one of the problems I had with this was retrospective is much different than, obviously a patient-driven, client-driven research study because, yes, there was people that had increased instances of psychosis. It wasn't enough to be clinically significant, but um, what was surrounding that issue? Did they have one psychotic issue and then they were better, 5-10 days later? Because they did track medication dispensing of psychological disorders in this, which was super interesting. But they didn't, were they refilling these meds? I don't know.
Did
What do
they
you
have
think?
a history of it? Or
Right,
were they
right,
using any other substances or any other medications that could have had a negative interaction? What kind of
right,
mental state were they in during the study?
right,
What did they use?
right.
Did they smoke? Did they vape? Did they do edibles? Did they do,
Good point.
use tinctures?
Right.
We don't
I don't
know.
know. We don't
They
know.
don't state that. So, there's definitely more room for further research. But like I've said with
Right.
all the other articles, I'm really happy that they're actually taking time and doing these studies because this is actually a step forward in helping to decrease the negative stigma that cannabis has. Because, at some
Right.
point there were
Right.
commercials, there were movies, there were um, politicians saying don't use cannabis because it causes you to become psychotic, so
Right.
studies like
100%.
these are still very helpful. Whether no one and
I
nothing
mean,
is perfect and there's always room for
no.
improvement, but
Yep.
yeah, I'm really glad that we came across this journal for sure.
Yeah. And I think people need to realize that in the early 1900s, 120 years ago, um, doctors were prescribing cannabis tinctures for different ailments, right? Endometriosis, pregnancy-related pain, nausea, pain,
Child labor.
headaches, it, child labor. It was part of the Queen of England was using this, right? The Queen of England sent a was one of the biggest first cannabis users in the world, and so it had its use. And then obviously, I think Bayer. There's a big thing about Bayer becoming, they invented aspirin and were able to put in a pill, and then there was a whole war on cannabis, and there was a whole smuggling thing with Mexico, and it was anti-Hispanic. There's a whole bunch of background of that. We don't
Hence,
have to get into that, but
hence where the word marijuana comes from, and that's why
marijuana,
a
right?
lot of people in the industry try to stay away from using that word
Right.
because of where it came from, as a little
Yep.
racism in there.
Right.
But sometimes it's a little easier to explain to people who are new to this industry the difference between
Right.
hemp, cannabis, and marijuana. Because if you just
Right.
say cannabis, because ideally I would like to just say cannabis, but then
Right.
they get confused. They don't know if it's hemp or marijuana,
Right.
But I definitely don't
Right.
like using that word marijuana.
That's why I tell patients like cannabis is the term, right? And then you got hemp and marijuana underneath it, and they just differ by the concentrations of THC. And there are some physiological differences, like in the plant shape and stuff, but genetically they differ mostly just on the cannabinoid profile of how much THC is in both. You there?
I'm here.
Um, Most people don't, like to use those terms interchangeably. So, I think we've come a long way. We still have a long way to go. Um, but this is another great article that I think really just points it in the right direction. It's all about proper use, proper patient at the proper time.
Yep, I agree.
So,
Well, thank you
So
for
where can
joining
everyone?
us. I think this is
Yeah.
the end of this article, right?
Right. Yeah. So medcannatoday.com, our website, we're going to start putting up some news articles. We have the YouTube channel, so you can watch the videos. We're on Spotify, we're on iTunes, we're on Anchor. And so please just continue to support the channel. Share these episodes so people can see us, so we get more viewers, and that way we can really spread the word of proper use of cannabis. So with that, thank you, everybody.
Thank you.